Hello again. I'm Nicholas Markey, physical therapist by day and online fitness coach by night. Today, I want to talk about placebo, kind of what it means, what we understand about it, and how it may apply to you and your situation. So, placebo basically refers to sort of the good feeling you get from something, could literally be anything. Um, but we're not quite sure. We call it non-specific, so we're not quite sure all the mechanisms involved with it. Okay, so basically, it would be like, let's say you have knee pain, you do something, and fairly immediately it feels better. Okay, oftentimes in that short enough time frame, whatever you did to the knee hasn't changed the actual tissues of the knee, hasn't probably changed much of the actual nerve wiring yet, but you feel better. So there's something else probably going on. Because tissue change takes weeks, months. Rewiring of nerves can take days, weeks, months as well. So likely if you say you had knee pain, you did something and then you immediately felt better, we would probably attribute that mostly to placebo in that time frame. Okay, so placebo literally it could be from anything, right? And so it's feeling better, okay, from that thing. So potential mechanisms involved, it could be what we call descending inhibition. So basically, if say that there were a lot of signals coming from the knee, what we call maybe nociceptor signals, oftentimes incorrectly referred to as pain fibers or pain nerves. They're not pain nerves, they're called nociceptor. So what those are related to is sort of like toxic signals in a way. Say that you did rough up your knee or something, and there were a lot of nociceptor signaling going up the nerves, up your spinal cord into your brain. Descending inhibition would be your brain kind of talking down and saying, stop it. And since there's also just potential processing changes going on in the brain, probably again, similar probably mechanism, sort of an inhibition type thing. So if when that information reaches the brain, then perhaps the brain goes, you know what, I'm not worried about this right now. We did a thing, it helped, and we could feel better. This is fine. Um, let's say that the knee was hurting, and let's say we had a device that could read the amount of nerve signals going up. From for the nerves in the tissues, the nerves in the spinal cord, nerves in the brain. Let's just say we had some sort of machine and we could do that. Let's say you're having knee pain and there wasn't increased nerve signaling, like you compared it left and right, and it was about the same. So then we might make the assumption that, it's probably not driven from something down in the knee, maybe it's driven from something higher. Let's say maybe the nerves in the spinal cords were firing a little bit more, some of the nerves in the brain. Again, potential inhibition from other nerves in the brain saying, I think we're fine. So it doesn't really matter that you would know all that. Just understand that it's complicated. So likely if somebody does something like say that you had knee pain, somebody massaged your knee for 10 minutes and it immediately felt better, they didn't change any of the tissues in the knee. I mean, they might have increased slightly the blood flow in the skin and stuff, but likely the improved feeling you got was probably mostly from placebo. And that's not necessarily that's not a bad thing, okay? It's when we rely on things like that indefinitely when maybe we're not doing the best, okay? So the more invasive something is, the higher the placebo, okay? So if say that I have this knee pain, okay? Let's look at the conservative thing. So there would be like passive interventions. Someone massages your knee, someone does ultrasound on your knee, those kind of things. And then, let's go to another slightly more invasive. So it's maybe someone sticks needles in your knee. Maybe somebody gives you a shot, the orthopedic doctor gives you a shot in your knee. And then let's say the next level could be like surgery, right? The more invasive you get, the greater chance of that placebo. Yes, even surgery has placebo, okay? The crazy thing is we don't know how long each person's placebo would last, okay? Sometimes it might only last like 30 or 45 minutes, right? Sometimes maybe it lasts indefinitely. We don't know, right? So let's say somebody had knee surgery for knee pain and they felt better after the surgery or whatever, and they felt better going on. It may not have been anything to do with what they did in the surgery. It could just be like you had knee pain, we did a really important thing, we fixed the knee, and then your brain goes, you know what? We're good. We don't need pain anymore. The problem is, if we try to rely on that, we don't know if that'll work, right? Because maybe what if you had knee pain, you did surgery to fix the knee, and then you had more pain? Like, I hate to say it's kind of like a coin flip. So relying on that is not the greatest thing in the world. If somebody says, I have knee pain, what do I do? And somebody's like, hey, do this surgery. It's 50-50. You might feel better, you might feel worse. What do you want to do? And the person might be like, I don't know. You want to cut me and I have no idea if it's going to help me feel better or not? I don't know about that. Um, Here's a cool thing is exercise also has placebo. Talking with somebody also has placebo. Okay? So if somebody does an exercise, they have knee pain, they do an exercise, and they immediately feel better, likely that's placebo. Somebody has knee pain, they talk to their physical therapist, they have a good conversation, and their knee feels better, probably placebo, right? But here's the cool part with those two interventions. So let's say the talking wasn't just chit-chatting, let's say it was like education, empowerment type stuff, like motivational interviewing, blah 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 blah, right? The patient feels, reassured, or the person with the knee pain feels reassured, maybe understands, we talk about the nerves and just pain in general, maybe they understand the situation a little bit better, they have maybe less fear, that can actually be a good seed planted to potentially reduce pain in the long run, potentially, and it's not invasive at all, right? I mean, I guess depending on the education is invasive, but if they also feel better temporarily, that's a cool thing too. So it's like a nice side benefit. Let's go the exercise route. Person has knee pain, they do some exercises, they feel better immediately, probably placebo. Okay, let's look at exercise as an intervention. Okay, so in the long run, everyone knows that exercise is really healthy for you, right? So let's say you did a good exercise, a well-dosed, loaded exercise, so not like super easy exercise, and not like ridiculously hard, but like the right amount of dose. So you're building up the tolerance and capacity of your knee, which would include all the tissues in the knee, and then all the nerves that go all the way up into the brain. Okay, so that whole system you're building up, right? So in the long run, that could have a lot of good positive effects. But in the short run, if it also has placebo, it feels better, that's pretty damn good too, right? So if you kind of compared two interventions, like let's say we compared massaging the knee, which just is all passive and probably only really has placebo as an outcome, versus exercise, whereas exercise probably has placebo as an outcome, temporarily, but then also has other great health and benefits and also kind of long-term benefits, I would tend to lean towards the exercise. And then speaking of the education, exercise is like, I think, kind of like real world education. So if like the person has knee pain, they do an exercise where they load the knee and they immediately feel better, that's very reassuring, right? So the brain's kind of like, maybe we're not, so damaged. We actually did pretty damn good at this. Like that can be very empowering, improving that person's confidence. If it's an exercise that's relatively simple, they're like, okay, I can do this, build up self-efficacy, person taking care of themselves, and then there's just that feeling of like, I'm doing something about my problem. That could be a big part of the placebo. When we do something, it oftentimes feels good, like the accomplishment, right? Think about like, you know, when something's dirty, you clean it and then it's clean. It's like, yes, I did it. I did something, right? You feel kind of good about it, right? So it's like you had knee pain, you did an exercise for your knee pain, and then you felt better. And it's like, okay, I did something about my problem. I'm taking care of myself. We feel very good oftentimes when we can take care of ourselves. Hence why I lean towards those two modalities. I mix that education and reassurance with the exercise because the exercise itself is kind of like non-word, non-talky education and reassurance, kind of like you're testing and demonstrating to yourself and your body and your brain and your protective system that, you know what, maybe we're okay. And over time, you can gradually progress that to build up the tolerance and capacity of, the knee, the tissues in the knee, the nerves in the knee, the nerves that deal with the knee and the spinal cord, the nerves and processing centers in the brain that deal with the knee, all of it, right? At the same time, you're going to be building up that person's ability to function better with that knee, right? And so if we look at it, I think you kind of go pound for pound. I think exercise wins hands down in terms of like if comparing it to like a passive intervention like a massage or something in the knee. Now, if someone's got, let's say they had 30 minutes to exercise and they also had 30 minutes to do massage, so like time wasn't as big a factor, then go for it. Go have a massage. I'm sure it's relaxing and that's fine. But I oftentimes see that people will skip the exercise and just do the massage, and they're just kind of spinning their wheels. And they're the people that oftentimes when they talk to me, they have had this problem for years on end. It's like, well, I get my massage every week or every month or whatever. Like, okay, but are you like loading this? Are you dosing this correctly? Right? Did you start with a good baseline and gradually build up, little by little over time, kind of up and down, but gradually up over time? Oftentimes the answer is no. And the reality is that since placebo is involved in that, I kid you not, I've had plenty of people, because I used to do a lot of manual therapy. I don't really do any manual therapy now. I used to have a lot of people that you're just doing simple exercise with them and talking with them, in between sets and stuff. And they would oftentimes feel better without me touching them and rubbing them and shaking them or anything. Okay. So let's finish this with talking about how we can enhance placebo in a good way. So basically, placebo, again, is the person feeling better, okay, for non-specific reasons. So let's say they're going my route, my style, where they're doing exercise. While we're doing this, I'm giving them fist bumps, telling them, hey, great job, giving them cues and stuff, make sure they're doing the technique correctly. In between sets, being like, damn, that was really good. You pushed a lot of weight on that one, and depending on the dosage and how they responded to that particular set, maybe we go up a little bit in weight. Say, hey, you actually did so good and that was kind of easy. Let's maybe ump it up a little bit, depending on the circumstances. So kind of enhancing potential placebo from that, right? So not only are we doing a good intervention exercise that's going to have a nice long-term, short to middle to long-term effect, right? But we're also enhancing any positive feeling we get from that exercise. So it really boils down to a couple of things. Don't be a dick. That's just, I don't know, man. That's just simple human decency, I guess, right? If you just ask yourself, would I want someone to be an a-hole to me or a nice person to me? I think most people want to be a nice person, want someone to be nice to them, right? So you're dealing with somebody who's got a problem, knee pain. We don't need to be an a-hole to them. Be a nice person. Be very nice, right? Enhance them. Pump them up. Get them pumped. Get them psyched, playing music. Like if you're in a gym setting, there's music playing, kind of get in the groove, right? Get them talking about whatever they like to, whatever they're into, like just get them kind of feeling like they're themselves. Because a lot of times when people have knee pain, they're like, that's kind of all they think about, or back pain or whatever, any pain really, that's kind of like their brain gets like so focused on that area. But like have them talk about like maybe they like poetry, maybe they like, certain video games, or maybe they're really into, whitewater rafting. I don't know, just talk about whatever. Get them kind of feeling like there's their person, because they are, get them feeling good about themselves. And then involved with that is, they're doing the exercise and pumping them up. Be like, hey man, you did, this amount of weight, this many reps, that was great. You did a great set. Let's see how we do in the next set. Let's do this. Fist bumps. Slaps on the back. Like, just that normal human. Just like if you had a friend. It's okay to be a clinician and be friendly. You don't necessarily have to be friends with the person, but it's okay to be very friendly, with them, in a professional way. Make them feel good about what they're doing, and how much, how much solid, good stuff that they're doing. Like, hey, you did this weight last time. You know what? You did this that time. Hey, we're making great progress. Let's do this. Da, 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 da. If they're having down weight, they're flared up. Maybe we have to drop the weight and reps or whatever. Say, hey, it's all good. That happens. We'll drop it. And then they do the lower weight and they feel okay doing that. It's like, hey, you still came in. You're consistent. We did it. We still put in some good work. We'll just gradually build up again. It's no big deal. It's just, think about if you were going through a tough situation, and what kind of person would you want around you? Would you want someone who's kind of supportive, positive, encouraging, or would you want someone who's just kind of an a-hole, who's kind of down on you? I've heard lots of therapists, just the kind of words they use, it's like, and I'm sitting there thinking, like, that's not going to enhance your outcomes, your placebo, guys. Like, oh, did you do your home exercise program? Why not? Kind of acting like this, like, stern teacher, right? No one likes doing homework. Don't make it like homework. Make it like it's this fun thing. Like, yeah, we're getting strong. This is awesome, right? Make it fun. Make it interesting, and likely you're going to have a greater chance of enhancing that placebo. And the best part of that is if you now do it with exercise, so you do it something active that they're in control with, they're building up themselves and everything they can do with that. And they also get a good feeling from that after it. Oh my goodness, like, couple that together. That's like that positive reinforcement. They're like, oh yeah, when I work out, I feel good. Working out is good. And since we know most people aren't working out like they should, it's like 10% of the population does, like, regular resistance training, which is insane, right? It's one of the best interventions we can do, and only 10% of our population is doing it, roughly. It's like, if you can reinforce that into somebody that, like, oh, working out the right amount, not too little, not too much, and feels good. My goodness, like, you could be creating a monster in a good way. This might be someone who months and years down the line is like, man, I love working out. I'm strong, and their knee pain is like a distant memory. So overall, dealing with placebo, I wouldn't try to rely on it solely. Like, if in my opinion, if you're only relying on passive treatments and that are likely just placebo, right? Like, just get an immediate feel good feeling, and that's it. I would highly encourage you to also work on active type of things, because they also have placebo too, but they also build up yourself in the short, medium, and long term. Okay, so let me know what you think. Placebo is a very interesting topic, and I'm planning on, I'm going to do a video on nocebo, which is the exact opposite of placebo. So feeling bad for non-specific things. So something we want to not enhance, right? We want to enhance placebo with these good interventions like exercise and education, reassurance, da 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 da. But we want to maybe, not enhance or whatever, de-enhance nocebo. Okay. So anyways, thanks for watching, listening, and I will see you next time. Peace.